This lecture will go over diarrhea and vomiting. Diarrhea, one of the most common disorders in childhood, is defined as an increase in the frequency, fluidity, and volume of stools. If not treated, acute diarrhea in infants and children can lead to dehydration, electrolyte imbalance, and hypovolemic shock. Acute diarrhea can be life-threatening in infants and small children if gastrointestinal fluid losses are not adequately replaced. Diarrhea with ensuing dehydration is a leading killer of children worldwide and is a major cause of morbidity as well as a primary sign of many other conditions. Diarrhea results from increased motility and rapid emptying of the intestines, resulting in impaired absorption of nutrients and water and an electrolyte imbalance. Water, sodium, potassium, and bicarb are drawn from the extracellular space in the stool into the stool, resulting in dehydration, electrolyte depletion, and metabolic acidosis. Diarrhea occurs when there is excess fluid in the small intestine. Most infectious causes of diarrhea are self-limiting, making comprehensive testing of minor cases of diarrhea impractical. In terms of treatment, the treatment of diarrhea is aimed at maintaining and restoring fluid and electrolyte balance and returning the bowel to normal function. Preventing the spread of infection to others is an important component of care, with meticulous hand hygiene being critical. Parents must be informed of specific fluid intake requirements and signs of dehydration, which signal a worsening in the child's condition. Treatment of diarrhea and prevention of dehydration include replacing fluids, continuing feedings, and closely monitoring and observation. Infants should continue to be given breast milk or regular strength formula. Common foods that are especially well tolerated during diarrhea are bland but nutritional foods, including complex carbs such as rice, wheat, potatoes, and cereals, yogurts containing live cultures, cooked vegetables, and lean meats. This recommendation is a change from the formerly recommended brat diet, which consisted of bananas, rice, applesauce, and toast. The brat diet can be tolerated, but is low in energy, density, fat, and protein. Preventing dehydration is a primary issue in the management of the infant or child with dehydration. Oral rehydration solution is given to replace each loose stool. Initial rehydration may require limiting the intake to smaller volumes or sips to reduce any incidence of associated vomiting, with a gradual increase in volume as tolerated. Feeding of solids or formula is started as soon as the child is rehydrated. The use of antidiarrheal medication is not recommended in children because of the binding nature of these products and the potential for toxicity. Antidiarrheal medications have not been found to shorten the course of the diarrhea, and in cases where the diarrhea is caused by pathogens, they may increase fluid and electrolyte loss by interfering with the body's attempt to rid itself of the organism and allowing the pathogen to remain in the body longer. Most children with diarrhea and subsequent dehydration have a relatively quick recovery, provided that the cause of the diarrhea is determined and therapy is started as soon as possible. Oral rotavirus vaccine is recommended by the CDC for prevention of diarrhea caused by rotavirus. Please review the purple nursing care box for the child with diarrhea on your own. It has some good information in it. And also please review the patient-centered teaching box for the care of the child with diarrhea. Vomiting, which occurs frequently in children, is usually a sign of some other underlying problem or disease. Vomiting has many possible causes, including infections, obstruction, motion sickness, metabolic alterations, and psychological alterations. Vomiting will manifest with sour milk curds without green or brown color and undigested food from the stomach. Green emesis usually indicates the presence of bile and possible intestinal obstruction. A fecal odor indicates lower intestinal obstruction or peritonitis. Emesis may be blood-tinged, or the color may be bright red or look like coffee grounds. Bright red blood indicates that blood has not been in contact with gastric juices. The force of vomiting varies. The primary focus of managing vomiting is detecting and treating the cause with the secondary intent to prevent complications. Oral rehydration therapy as indicated for the treatment of diarrhea in Table 40.3, is also appropriate for the vomiting child. Most episodes of vomiting can be managed at home with small, frequent amounts of oral rehydration solution to prevent dehydration. Then resuming a regular diet is tolerated. In the hospital setting, the practitioner and parents must estimate the volume of emesis and replace it. As the vomiting decreases in frequency, the amount and interval between feedings can increase. However, if the vomiting is severe and prolonged in neonates and young infants, IV therapy may be initiated. Most children will respond well to treatment, but some will need antiemetics. Please review the purple nursing care box regarding the vomiting child on your own. What type of dehydration is defined as dehydration that occurs in conditions in which electrolyte and water deficits are present in approximately balanced proportion? Go ahead and pause the video and pick out your answer. The correct answer is A.